what are some of the common treatments that a child might be prescribed for allergic asthma?
Well, there are many treatments. The treatment for allergic asthma really depends on the severity of impairment and the risk of having symptoms that could progress to an asthma attack. Typically, if one has allergic asthma, the most important therapy is how to alter the environment to decrease exposure to whatever the patient is allergic to. Additionally, we also treat with antihistamines, inhaled corticosteroids, beta-2 agonists such as albuterol, leukotriene inhibitors like Singulair, and if someone is really sick and they come to the ER or go to their doctor, sometimes they even need systemic steroids for a severe asthma attack. There are some newer treatment modalities that if a child's asthma fulfills certain criteria, they can be considered for treatment with a monoclonal antibody called Xolair. This new therapy is really promising for allergic asthma.
Now, I know, especially with smaller children, parents get very concerned about the possible side effects of asthma medications for their children. What should parents know about side effects, and is there anything that can be done about that?
That's a great question, and I think I know what you're alluding to. Just like anything in medicine, there are side effects, but it's important to weigh the risks versus the benefits. I always tell my patients and their families that poorly controlled asthma has a severe risk of complications and sometimes even fatality if not treated or managed properly. Most allergy and asthma medications have an excellent side effect profile, and they rarely interact with other medications. The typical common side effects from inhaled corticosteroids are hoarse voice and oral thrush, which is a type of fungal infection. These can easily be avoided by rinsing your mouth after taking the medication. I think the major concern for parents is growth. Many chronic conditions can affect height. One of the conditions is asthma, where the height is affected, especially if it's not treated or controlled. There have been several studies that are published that show that inhaled corticosteroids can reduce the height velocity or the rate of growth in children. The studies out there are conflicting at this time. Overall, the effect of inhaled corticosteroids on adult height, on the final adult height, appears very small based on recent studies, and most children attain their expected adult height anyway, which is the average of both parents. Therefore, it is of utmost importance to treat asthma.